President Obama succeeded where 7 of his predecessors, both Democrats and Republicans, failed in the effort to provide universal health care coverage. The Affordable Care Act, known more commonly as Obamacare, for some crazy reason, was a hard-won victory that is already being overturned by Donald Trump and the Republican Congress. I recently spoke with Dawes, a health care attorney and the author of 150 Years of Obamacare, about the impact a repeal can have on Americans.
You know, one of the confusions that we are seeing, and you've heard reported, is that many folks who voted for President-elect Trump actually, and who are beneficiaries of the Obamacare program, many of them didn't realize that they were actually benefiting from Obamacare. So, you know, I understand your point about perhaps we shouldn't have embraced it, but I think maybe a mistake was that even in Democratic led states, the governors who were Democrats who were establishing their own exchanges, they shouldn't have run away from it too much, I think, because now folks didn't even realize, gee, my Affordable Care Act was actually Obamacare.
But in talking about this, I mean, clearly this is going to be one of his most important, I would say the most important thing he accomplished as president. But do you also believe they failed to properly sell it? And he's even talked about that they did not, frankly, explain it, champion it, and so you left it up to the critics to frame the narrative.
Absolutely. So, you know, President Obama, actually, when you talk about his legacy, he's the only presidential candidate ever to have said he was going to prioritize racial and ethnic health disparities in a health reform proposal. And he did so in the Affordable Care Act. So now we have the most comprehensive health reform law ever that addresses health disparities among racial and ethnic groups and other vulnerable groups. But the issue lies, though, with, yes, we lost the PR battle. And I think we lost it because opponents were able to outspend us during the negotiations 7-1. And then afterwards, they more than doubled their money to oppose this law, to undermine and to bring it in, put it in the negative light.
When we think about the Affordable Care Act moving forward, obviously you see what Republicans are trying to do right now. You were one of those architects of it. Can they actually repeal it and replace it? This whole idea of improve it, can they? I mean, you know, how? How can they say, oh no, it's going to be totally different, everybody's going to get insured, kids still going to be covered, pre-existing conditions? But that sounds like the current plan.
So you remember right before the election, a lot of folks thought that Republicans were blowing hot air when they said they were going to repeal. Well, I argued differently and said it's happened before. We know that it's happened before in the past, and it can happen again. And so, yes, they can dismantle it, and they're doing so through the budget reconciliation process, which, as you know, and many of your viewers know, is a way to get at the budgetary provisions of the law, the taxes in the law. So that means that everyone that has insurance through the health insurance exchange or the marketplace and are getting subsidies, they stand to lose, and this is 80% of the folks in the insurance market, they stand to lose those subsidies. Anyone who has gotten insurance through Medicaid with the Medicaid expansion, they stand to lose coverage as well. So they can undermine the ACA in a significant manner, even though they may leave what we call the more popular provisions, as you articulated very well in the beginning of the segment. So there is a real worry because we know that African Americans stand to lose. There are about 3 million African Americans who have gained insurance through the exchanges, and their insurance is in jeopardy. And in all, we know that 30 million people stand to lose coverage, not just the 20 million that have gained insurance, but 30 million. So why is this a big deal? When you look at the Republican proposals, though, just want to take a minute to highlight for your viewers what's really at stake here. At the best case scenario, 15.5 million people or more stand to lose coverage. And at the worst case scenario, we're looking at the 30 million standing to lose coverage. And every single one of these Republican repeal and replacement plans that are out there actually have been shown to increase the cost. So if people are really upset about cost right now with premium, deductibles and copays and others, they're going to be in for a real sticker shock if this repeal takes place.
All right, folks, so let's break it down with our panel here. Jason Johnson, Angela Rye, Greg Carl, Victoria Burke. Affordable Care Act, Huge, great impact on African Americans as well. The number of black folks I've talked to who said, man, I had family members who never had health insurance. Folks who said, finally, my children are also on my health care. This will no doubt will be the most important achievement of his 8 years as president.
You know, this brings back, I think, an interesting point of intersection to Lauren's last immediate point, which is about symbolism. And I think that this is the time where symbolism and policy really meet. So the fact that a black president could ensure and then make sure that all of our folks would get coverage is huge. I think that this is one space where where that's worked out really, really well. Of course, we haven't seen that same type of intersection work when it comes down to electing new folks and even turning out for elections where he's not on the ballot. But I think this is one signature achievement where that intersection matters.
If it wasn't for white Southern governors, there'd be more people covered.
Oh, yeah. Absolutely.
The president, to me, this is his second biggest achievement after killing Osama bin Laden, the health care bill. He did choose health care over jobs in his first 2 years, and a lot of people thought that was a mistake, but actually looking back on it,
it was the smartest thing in the world, because if this had not been done that first year, it was not going to happen.
Right. Here's the thing. It's a lot like the stimulus. One of the reasons the president didn't get enough credit for the stimulus is because, well, people can't tell what didn't happen, right?
Also, they failed to sell it, and he's admitted. But he's admitted. You know what? We didn't sell it.
Exactly. And the thing is, I was in Ohio. Like, we saw, there were signs on everything from the stimulus. He should have done that in more different places. But I tell you this, one of the greatest indicators of Obama's legacy is going to be after the Republicans destroy the ACA, and we will see a sharp contrast in coverage, the economy, and everything by 2018, 2020. Him being sandwiched between George W. Bush, who no one liked when he left office, and Donald Trump, who no one likes coming into office. When they destroy that legacy, that'll be the clearest thing as to how great his 8 years was. Do you really think
they're going to destroy it? I mean, let's be clear. You're right. The first 2 years, that's basically where you see Barack Obama do everything he can.
Got it.
Everything since then has been a reaction. I don't know that they're going to be able to reverse engineer something that was their plan to begin with.
Well, they will try.
They will try. They will try. Look, they're going to.
It's going to come down to 3 senators.
They're going to keep trying to pull it apart like Ginger. The whole thing's going to be a mess. And then by 2018, they're going to try and delay it and claim that something else is going to happen.
All right.
Kickstart your day at 7 and get the news you need from the perspective you want. NewsOne Now with Roland Martin. Every weekday morning at 7 on TV1.